All right, guys. Hi, everybody. Thanks for joining us today. And thank you for taking your time out of your day to learn in and outs of Medicare and some costly mistakes that you could really impact your coverage. We have quite a few people on the webinar, so we've muted everyone. So if you have any questions, please submit them through the Q&A function at the bottom of the screen. I always say that a stupid question is a question not asked. We will try and answer as many questions as we can live as possible. And if we're unable to get to your question, we'll be sure to follow up with you. The webinar is being recorded, and we'll send out a replay in a few days. And just a little bit about our firm. We're not your typical financial planning firm. Most advisors just manage assets. We actually run point on your entire financial life. Think of us as your quarterback or really the CEO of your financial team. We make sure your accountant, attorney, and insurance folks are all playing the same game. So instead of getting three different opinions, you get one clear coordinated strategy. Our clients love it because it saves them stress, time, and often lots of money. One component of our planning is Medicare planning. So we invited Bill Webb, who is the owner of Saratoga Medicare Advisors and managing partner of Saratoga Benefit Services. I call him the guru of Medicare and employer medical insurance plans. Bill has helped hundreds of individuals nationwide understand their costs and options with Medicare. So, with that all said, I'll hand it over to Bill. Bill, go ahead.
Yeah, thank you, Andrew. Appreciate you having me here today, and happy to go over this with everybody and answer some questions. So, like Andrew said, as we go through the presentation here, feel free put your questions in the chat. We will get to them. He'll interrupt me a little bit, and we'll answer all those questions as we go. As well, you'll see on the bottom of my slides all my contact information. Andrew will be sending this out afterwards, where you can schedule a one-on-one call with me. There will be a Medicare intake form that'll get me all the information that I need for quoting plans and everything. And with that, we can go through this stuff kind of one-on-one, talk about your specific situation. If you're retired, if you're considering retirement, if you have coverage through an employer, and understand exactly what those cost timelines and options are for Medicare coverage. So a little bit about us. Our job as a Medicare broker is to provide clear and objective information and guidance as far as Medicare goes. So we work with a bunch of different carriers throughout the country, providing Medicare supplement, Medicare Advantage, and prescription drug coverage. And our goal is to give you guys, clarity and confidence when you're making this decision, which that can be a lifelong decision when it comes to your Medicare coverage. So, we give you objective advice to, help you make that decision. Whether it be to go on to Medicare, stay on an employer health plan, whatever it may be. In addition to Medicare services, like Andrew said, we work with businesses and do group health plans, and we also do individual plans. So maybe you're turning 65, but your spouse isn't quite 65 yet, so they need an individual plan to help them bridge that gap between, whatever age they are and becoming Medicare eligible. So we can assist with that as well. Happy to work with you guys on whichever front, whether it just be, understanding what these options are or enrolling in a plan. So without further ado, let's get started a little bit. So Medicare Basics. So what is Medicare? Medicare is the federal program for health insurance for people age 65 or older, certain people with disabilities, people who have been on Social Security disability for more than 24 months, people with end-stage renal disease or Lou Gehrig's disease or ALS. There's two options for how you can get your Medicare coverage. That's Original Medicare. You'll hear me talk about Original Medicare for the day. Original Medicare is Medicare Parts A and Part B. That's issued through Social Security. So the one option is Original Medicare plus a Medicare supplement or a Medigap plan. You hear me say that through the presentation as well. Medicare supplement and Medigap are the exact same thing. And the other option is a Medicare Advantage plan. And Medicare Advantage plans are often called Part C. They're technically not a part of Medicare. They actually replace Original Medicare. And we'll talk about that in more detail as we go through the presentation as well. So the parts of Medicare. So Medicare is a bit of an alphabet soup. You hear, Part A, Part B, Part C, Part D, Plan G, Plan F, Plan N, all these different things. So what do they mean? So Original Medicare is Medicare Parts A and B. Medicare Part A is your hospital insurance. So anything that happens in a hospital, whether it be a surgery, emergency room, some nursing home care, limited nursing home care, home health services, and hospice are all covered under Medicare Part A. and Medicare Part A covers 80% of those costs. Medicare Part B is your doctor's insurance, so medical insurance, anything that happens at a doctor's office, a specialist, some outpatient care. It covers durable medical equipment, as well as your preventative care and some home health care as well. Medicare Part B, there is a premium for it, and it's income adjusted. We'll talk about that through the presentation as well. You'll see Medicare A and B cover 80% of those expenses. So that's where your Medicare supplement plan or Medigap plan comes in. And that fills that 20% gap or supplements original Medicare to give you 100% coverage. Medicare A and B and the supplemental plans do not cover prescription drugs. So then generally you need a Medicare Part D or prescription drug plan, which covers your prescription costs. These are run by private health insurance carriers like your Aetna's, SilverScript, WellCare, Humana, all these different plans. There's thousands of different Medicare Part D plans throughout the country. The premiums for them, there's a monthly premium from the carrier. And then there's also, depending on your income, they can be income adjusted, which will be billed through Social Security. Separate from all of this is Medicare Advantage, Medicare Part C, which is another way to get the benefits that are covered under Medicare Part A and B. With the Medicare Advantage plan, you do still pay your Part B premium, but you're not actually using the federal original Medicare program. You're using a private health insurance plan. These plans often wrap up everything all into one, so they will generally include prescription drug coverage. Some of them do include some dental vision coverage as well, and these are run by private health insurance carriers, again, like your Aetna's, Humana's, Mutual of Omaha, AARP, which is through United Healthcare, and these have varying premiums. So some of these plans are even, no premium. Others, the premiums can get pretty high. With these plans, generally, you do kind of get what you pay for. So those, zero premium plans you want to be kind of, you want to dot your I's and cross your T's when you're looking at those benefits and make sure that they're going to work for you. So we'll talk about those in more detail, again, as we go through the plan. So going on to the premiums. So these are the 2025 premiums. The 2026 premiums actually have not been released yet. They do have some estimates on approximately what they're going to be. And I believe they're going to be the base premium. You'll see here the income tiers filing jointly less than $212,000 a year of income. You're going to be paying that base premium of $185 in 2025. I believe it's going up to about $206 in 2026, but that has yet to be released. So, we'll keep you updated on when those premiums come out. The income tiers are based on a 2-year look back. So here in 2025, they're looking at 2023. So, if you had high income, you were a high income earner, anyone making over $750,000 a year, they're going to pay $626 for Medicare Part B. So it can get pretty pricey. In the event that you have a life change event, so maybe you retire, you have a work reduction, your income is going down, you can appeal these premiums to get brought down to a more appropriate level with where your income is and where it's going to be in the future. So it's a very simple form. You submit it directly to Social Security, and they will honor, basically your word on what your premium will be. With that, if you come back at the end of the year and you said you were going to make, $100,000 a year and you end up making $400,000 a year, they are going to recoup any underpaid premium. So, if you go the whole year paying that $185, but you should have been paying $589, they're going to get that premium back at the end of the year when they reconcile with your taxes. So important to understand that. Just because you were a high income earner and you've retired, your income has dropped, doesn't mean you're stuck paying that high premium. Really important to stay on top of those appeals for that IRMAA. These adjustments here are called IRMAA amounts. That's the income related monthly adjustment amount. Part D, you'll see there, same income tiers. Anywhere under $212,000, you're just going to pay that same, Part D premium. Generally, prescription drug plans are pretty affordable as far as premiums go. The lowest cost plan here in 2026 is going to be $4.40 per month in the state of New Jersey. But they can get pretty expensive depending on what your prescriptions are. So if you're on more, name brand, higher tier specialty prescriptions, it's likely you'll be in a more expensive premium Part D plan, but that will pay more for those more expensive prescriptions that you have. And will likely be the lowest cost option depending on, what those costs are, how often you're filling those prescriptions. And again, you can appeal this, if you have a life change event. The income tiers are based on your modified adjusted gross income. Most people, this is the same as their adjusted gross income, but it does add some stuff back in, student loan interest, IRA contributions, things like that. So things to be aware of. But for most people, it'll be the same as your adjusted gross income, and your modified adjusted gross income will never be lower than your adjusted gross income. Here's some information on the appeal form. There is a link for here where you can get this form if you do want to file that appeal. I believe Andrew is going to be sending out the slides afterwards, so all the links in this will be active. You guys can click on them and get some more information or submit these forms directly to Social Security if you have that one of these life-change events that you can see here. So marriage, divorce, death, work stoppage, or work reduction. All of these things would qualify for a life-change event that can lower your Part B premium. Let's see, Medicare and employer size. So employer size is really important for Medicare, and if you have to sign up for it or if you can defer enrollment. So when it comes to employer size, this follows your health plan. So if you are continuing to work past age 65, maybe the husband works for a big company and the wife works for a smaller employer, and if they have coverage through the smaller employer, then Medicare is going to be primary. So you're going to have to sign up for Medicare A and B right when you turn age 65. If you work for a larger employer and you're covered on a large group health plan, Medicare is going to be secondary. So that means you can defer enrollment in Medicare without penalty. And when you go to sign up for Medicare, you'll just need basically a form that states that you've had continuous coverage past age 65. And with that, you'll have a guaranteed issue period to sign up for Medicare A and B without any penalty. As well, Medicare Part A is usually premium free. So you can enroll in Medicare Part A when you turn age 65 if you want. It's just basically extra benefits above and beyond your large group health plan. If you are enrolled in a health savings account, Medicare Part A, if you are enrolled, actually takes you out of that high deductible health plan. So you can defer Medicare Part A if you want to keep contributing to an HSA. So really important, Medicare Part A actually has a 6-month look back period. So it's a bit of a weird thing there. But with Medicare Part A, technically you have to cease HSA contributions 6 months prior to enrolling in Medicare Part A. Again, if you want to continue to contribute to your HSA, you can defer Medicare Part A. You have to do that through Social Security. So enrollment scenarios. If you're turning 65 and enrolled in Social Security benefits, you'll automatically be enrolled in Medicare Parts A and B. Within the 3 months prior to your birthday month, you would get your Medicare ID number and Medicare ID card in the mail stating that Part A and B start date, which is usually the first day of your birthday month. So my birthday is November 18th. I'll be eligible to start Medicare on November 1st. If you're turning 65 and you're not enrolled in Social Security benefits, you can enroll in Medicare Part A online via ssa.gov or by going to your local Social Security office, but you will have to actually physically go and enroll in Medicare A and B coverage. If you're past age 65, you're continuing to work covered on a group health plan, you can enroll in Part A and Part B through ssa.gov. If you're past 65 again, to enroll in Part B, you'll need a special enrollment period, which you'll need to complete a request for employment information that needs to be signed by your employer, basically stating that you've had continuous coverage since turning age 65. With Medicare Part D, you have a 63-day special enrollment period from when your coverage ends. So if you retire, don't sign up for Medicare A and B right away. If you go more than 63 days without Part D coverage, then you can start to accrue penalties, and we'll talk about those penalties a little bit more. But really important. I mean, most people want to just make a seamless transition right from their group health plan into Medicare. So generally, once you know your retirement date, as soon as you can, you want to start and get the ball rolling with Social Security as far as signing up for A and B. And then you can obviously reach out to me to talk about supplemental advantage plans, Part D plans, all that stuff. So the sooner you can get the ball rolling on this, you don't want to wait till the week before you retire to start signing up for all this stuff. As soon as I'm retiring, you want to get the ball rolling on this and make sure you're on top of things so you're not incurring any penalties.
And quick question, Bill, for you.
Yes.
How does COBRA impact that
Great
waiting
question.
period of time?
Yep. So, with Cobra, Cobra allows you to continue your group health insurance coverage even when you retire or if you leave the group health plan. Cobra actually transitions your group health plan into an individual plan. So with Cobra, you would fall under that under 20 employee range. So your Cobra coverage would actually be secondary to Medicare A and B. If you're past age 65, general rule of thumb, you don't want to take Cobra, okay? You'd have to sign up for Medicare A and B and pay that Part B premium. Plus, you'd be paying the entirety of your group health plan premium, which is usually pretty expensive. So, with Cobra, if you're past age 65, you certainly want to avoid it. If you are, maybe 64, Cobra's not a bad option. You can keep it for 12 months and then sign up for Medicare when you turn 65. Generally, you have 18 months of Cobra coverage. So you just want to make sure, if you're turning 65 within that window, you're signing up for Medicare because that group health plan, Medicare A and B, like I said, pay 80% of your expenses. Your group health plan will not pay what Medicare would otherwise pay. So if you have a Cobra plan, you're past age 65, you don't have Medicare A and B, you're going to be on the hook for the first 80% of your expenses. So really important and good question there, Andrew. Happy to expand on that if anyone has any other questions.
And then one other question just relating to a previous topic about the 20 employee rule. So like, what is the best way for people to determine, like, because I would assume that some employees don't know how many employees there are at the company, is it like HR is the best way to figure that out?
Yeah, HR, smaller companies who might not have HR, just, talk to ownership or
Okay.
a manager, and again, that's one where, depending on your employer, even if you do work for a larger employer, you do want to evaluate your group health plan options during open enrollment, see what those deductions are, what you're paying for that coverage, and compare that to what your Medicare costs could be, because Medicare is generally fairly affordable and the coverage is very, very good. So if you are somebody who might, be reaching your deductible each year or reaching your out-of-pocket maximum, you have, maybe significant medical expenses each year on that health plan, Medicare can be a great option in lieu of the group health plan, even if you are continuing to work. So worth investigating again if you fall into one of those situations where you do have high health insurance costs and high out-of-pocket costs for your health insurance services. Okay. Looking into enrollment period. So your initial enrollment period is going to be your first enrollment period when you're turning age 65. It's a 7-month period. It starts 3 months before your birthday month, includes your birthday month, and ends 3 months after your birthday month. So during this period, you can enroll in Medicare Part A and B, no questions asked. You're guaranteed, to be enrolled on the start of your birthday month or the first of the month after you apply. So if my birthday is in November, if I don't apply in November, I apply in December, my coverage is going to start January 1st. Okay. Next, you have special enrollment periods, and this is what would apply to those larger employers. So if you're covered for a large employer health plan, you leave that group coverage, you have an 8-month period after that employment ends and that employer coverage ends to sign up for Medicare A and B without penalty. If you go past that 8 months, penalties can start to accrue. And as well, as I mentioned, if you're past age 65, you leave your employer health plan and you don't immediately sign up for Medicare, but you take Cobra, the plan is not going to pay what A and B would otherwise pay. So generally, I don't recommend people wait till the end of this special enrollment period. They want to, try to make things happen seamlessly and sign up for Medicare right as their group plan is ending. Late enrollment penalties. So, I mentioned those enrollment windows and waiting till the end or past those. You can start to accrue late enrollment penalties. And late enrollment penalties are not a one-time penalty. It's not something you pay, one time and it's done. They accrue and they're added to your Part B or Part D premium, and you pay them as long as you have Medicare. Most people, once they go on Medicare, they never leave Medicare. So you're, typically on it for the rest of your life. So if you do accrue these penalties, they can add up, they can, be added to your Part B premium and you'll pay them forever. The Part B penalty is 10% of the Part B premium for every 12-month period that you delayed signing up for Medicare Part B. Okay. So that can, certainly add up with the Medicare Part B premium being, estimated at $206. It can certainly add up and be added to that Part B premium. You can, spend a lot more on Part B than you need to if you do accrue those penalties. The Part D penalty is a little bit less. It's 1% of the national base Part D premium. This year, it's around $30 to $35 per month is what that base, that premium average is, times the number of months you went without coverage. So I mentioned that 63-day period. So if you go 63 days without Part D coverage, and then, you continue on for another 6 months, those penalties are going to start to accrue, and they're going to be added to your Part D premium, which is billed through Social Security each month. So really important. You want to avoid these penalties at all costs because they're never going to go away. And we can obviously help you figure out which plans work for you for Part D. They're generally very affordable. And I talk to, another question I get all the time is people who don't take any prescriptions. I don't take any prescriptions. Why do I need a Part D plan? Well, this penalty is why you need a Part D plan. And that's where I generally recommend at least signing up for the most base plan each year, which this year again is $4.40 per month. So even if you're not taking anything, it's better to pay that $4.40 for the plan, so that way you're not accruing these penalties. And then when you do need prescription drug coverage, you may be paying for a more expensive plan plus all of these penalties. So, really good to avoid that. And again, we can help figure out what the best Part D plan is for you.
And I'm sure in your experience, Bill, you've dealt with maybe Social Security quite a few times, and they're always a little bit difficult to deal with. So it's like getting it right out of the gate is always the best way to
Definitely,
go
yeah.
about stuff.
And like I said, with starting early, I mean, the Social Security, it does vary from office to office. I will say some offices are more prompt than others, but it can certainly be like the DMV a little bit where you're, waiting or you're on hold or you're, uh, not everyone is as up to date on some of the rules as they should be. So, I've talked to people who get some bad advice from Social Security. So the sooner you can get on top of this stuff, the better. That way you're avoiding, if there are any hiccups or anything like that, we can get that out of the way prior to you starting Medicare coverage. And that way there's no delays or penalties or anything like that. So now getting into the plans a little bit and some of the more, details of this stuff. So Medicare Advantage plans, I mentioned, is an alternative way to receive your Medicare benefits. It replaces original Medicare Parts A and B, although you do still pay your Part B premium. You would also still pay any adjustments if your income is higher for both Medicare Part B and Medicare Part D. And Medicare Advantage plans have to cover everything that original Medicare covers, but they have some autonomy on how they can, cover these things. So they can have things like referrals. They can have prior authorization for, major services. A lot of them have networks. You'll see here like HMOs, PPOs, private fee-for-service plans, where you have to remain in network. You can only go to certain doctors. And if you go to outside providers, there's either going to be limited coverage, if any coverage at all. So with these plans, the coverage can change every year, as well as the network. So Medicare Advantage is the subject of a lot of different legislation. And these plans you'll see, as far as reimbursement rates from Medicare for certain services and from the carriers. You've seen a lot of hospital groups in, different parts of the country actually leave Medicare Advantage and no longer take certain Medicare Advantage plans. So these plans are more subject to change year over year. They're one where every year you want to, look back and make sure that this plan is still going to work for you. For your doctors, for your prescriptions, and based on what your healthcare needs are. With these plans, generally, Medicare Advantage plans do have lower premiums than your Medicare supplement plans. However, you generally have higher out-of-pocket costs when you go to the doctor. So these plans include things like deductibles, co-insurance, co-pays for services, and then some limits on, length of hospital stays, physical therapy, and skilled nursing care. So with that, again, you're going to pay a little bit less, maybe month to month. But when you go to the doctor, if you do have, a bad year where you have a lot of expenses, I believe the out-of-pocket maximum for Medicare Advantage plans this year is, I believe it's $9,600. So, it can be pretty significant. And we'll compare that on the next slide with Medicare supplement plans. and what those costs are. With these plans, every year, the annual enrollment period runs from October 15th to December 7th. So we're right in the middle of that right now. During this time, you can change your Medicare Advantage plan or your prescription drug plan to change and start on January 1st. So if you do go with the Medicare Advantage plan, this time of the year is very important. You want to, make sure, again, as these plans change, they almost always do have little tweaks, whether it be to just the co-pays or maybe the deductible, or bigger changes like changes to their networks and hospitals and doctors that they cover. So really important to stay on top of that if you do go with the Medicare Advantage plan. Make sure it's going to work for you year over year. Medicare supplement plans are, again, they supplement or fill the gap that original Medicare leaves. These plans are standardized. So you'll hear about Plan G, Plan N, Plan F, Plan H, all these different plans. And that plan design is standardized by CMS, the Center for Medicare Services. So Plan G, there's not going to be any difference in coverage from one carrier to the other. It's always going to be, Plan G is generally the richest plan. But there are differences in premiums from carrier to carrier based on the administrative costs that those carriers incur. With these plans, you do have varying rates of coverage with, Plan G and Plan N specifically are the two most popular. Plan F, actually, they closed off enrollment for. So if you turn 65 after January 1st of 2020, you can no longer enroll in Medicare Plan F. And that'll continue with these plans. They'll introduce new plans and close off enrollment into, certain plans as time goes on. With Medicare supplement plans, you can go to any doctor in the country that accepts original Medicare with no network restrictions. About 96% of doctors and hospitals in the US accept original Medicare. So with these plans, you can go to any doctor, any hospital in the country. If you want to go to a specialist, Johns Hopkins, you can go there. You want to go to NYU, go ahead. If you want to, fly out to California and go to Cedars-Sinai, go for it. There's no issues with that. As far as, changes go, I mentioned some hospitals leaving Medicare Advantage. With original Medicare, the hospitals are being reimbursed for 80% of their costs through original Medicare A and B. I do not anticipate that you're going to see major hospital groups or doctors groups leave original Medicare because their reimbursement rates are so high. So you have, a little bit more confidence long-term, I find, with Medicare supplements, being able to go to, your doctors, your specialists, your hospitals, or, any specialty hospitals, wherever you may want to go, if you have an ailment that requires something like that. As far as these plans, you generally pay a monthly premium for the Medicare supplement plan along with your Part B premium. These premiums, to give you an idea, for a 65-year-old, Plan N premiums generally range between about $100 and $140 per month. Plan G generally is a little bit more expensive, between about that, $140 and up to $200 per month. To give you an idea on the plan designs for these plans, and I'll talk about Plan G specifically, Plan G this year has a $257 deductible. So you're responsible for the first $257 of expenses. Once you pay that $257, you're covered at 100% for the rest of the year. So with Plan G, even if you have that $1 million claim, you're paying $257, and then you're covered in full for the rest of the year. Okay. With these plans, it's best to enroll during an open enrollment period or your special enrollment period. So either when you turn 65 or when you're leaving that group health insurance plan and signing up for Medicare Part A and B. You typically want this plan to start right when you start Medicare Part B, or at least within that, that window. So that way you're not exposed to that possible 20% co-insurance. The question I get often too is, oh, well, 80% coverage is pretty good. I'm pretty healthy. Why do I need to sign up for a supplemental plan or an advantage plan? Well, if you just have Medicare Parts A and B, that 20% co-insurance, there's no out-of-pocket maximum. So unfortunately, $100,000, $1 million claims are pretty common nowadays. In the event you get that $100,000 claim and you just have Medicare A and B, you're going to be on the hook for $20,000. Get that $1 million claim, $200,000. So really important to, at least sign up for something to protect you, from those, astronomical out-of-pocket costs, whether it be a Medicare Advantage or a Medicare supplement plan. So again, going into the key differences here. So Medicare Supplement supplements original Medicare, where Medicare Advantage replaces it. Medigap or Medicare Supplement has a little bit more flexibility with providers. You have that national network, anyone that accepts original Medicare, whereas Medicare Advantage, you have generally HMOs and PPOs that have different benefits for different doctors or providers, or maybe no coverage for out-of-network doctors. Medicare Supplement tends to have a little bit higher premiums, but much less as far as out-of-pocket costs go, whereas Medicare Advantage is typically going to be lower on your fixed costs, but more out-of-pocket costs depending on how you use the services. So, whether you're going to certain specialists, hospitals, all those things, generally those are going to have be subject to a higher deductible, plus you'll pay a percentage of the cost afterwards, or higher co-pays and co-insurance. Medicare Advantage, the plan structure changes annually, whereas Medicare Supplement plans, the coverage does not change. So I mentioned those standardized plans. Those plans, the benefits will never change. The deductible of $257 may go up a little bit, but other than that, it's always going to be 100% coverage after the deductible. Okay. Enrollment. Medicare Advantage plans have an annual enrollment period each year, so you can change that plan each year, where Medicare Supplement plans have a guaranteed issue period when you're first eligible for Medicare, or if you qualify for a special enrollment period. If you are not in a guaranteed issue period or a special enrollment period, you'll have to answer underwriting questions prior to your enrollment, or you can be accepted or denied coverage from a Medicare Supplement plan. Okay, really important here. And I want to touch on this a little bit more. So, if you go with, you're healthy, you want to go with that low premium plan and have those low fixed costs, so you go with the Medicare Advantage plan. Then something happens, you get sick, you maybe meet the out-of-pocket maximum, and you decide, I want to switch to a Medicare Supplement plan. You can try to, all right, you can, submit underwriting questions where they're going to ask about your doctors, specialists, hospitalizations, surgeries, lists of prescriptions, height, weight, all that, smoking status, all those things. And at that, the carriers are going to review your options, review your medical history, and either determine if you can be accepted to the plan or denied from the plan. You can also be accepted to the plan, but at a level 2 rate, which is generally much, much higher premium. So with this, it can be, kind of a lifetime decision going with Medicare Advantage versus Medicare Supplement. Okay, so really important there.
So
Andrew,
Bill,
let's see
yeah.
for me.
So you're basically saying that, like, if you have a pre-existing condition, or if you don't know if you do have a pre-existing condition, and you try to save money on the front end by taking the Medicare Advantage, but then you're like, oh crap, I need a better coverage type of plan, and you try and switch over, they can basically deny you for that pre-existing condition once you switch
Exactly.
over to a Medicare Supplement plan versus the
It,
Medicare Advantage.
Exactly. And the reason, with some healthcare reform in the past, with individual health plans in the health insurance marketplace, they've eliminated, rate increases and denying people because of pre-existing conditions. With Medicare, because you have the option of going with Medicare Advantage regardless of your health status, with Medicare Supplement plans, they can still underwrite. So you do want to think a little bit more long term when it comes to Medicare, not just because today I'm healthy. Things can change in a day. So the underwriting is something that certainly comes into play. I run into often, generally it's from the kids of an older person who their mother's in their late 80s, 90s. And she's in this Medicare Advantage plan, and now she needs to go to a skilled nursing facility, and she only has coverage for maybe 20 days. They want to switch to a Medicare Supplement plan. Unfortunately, generally in that situation, they're going to be declined from changing to a Medicare Supplement. So really important to understand that, take advantage of your special enrollment periods or guaranteed issue periods for these supplemental plans, and make sure that you can make that change. Now,
That's
in
huge.
some states, they do have, and not here in New Jersey, and generally this has resulted in rates going up. But some states, they have what's called the birthday rule, where on your birthday each year, your birthday month, you can actually switch to a Medicare Supplement plan without underwriting. That is, not the case here in New Jersey or in Pennsylvania. I believe it is in New York. What you see when states adopt that is generally people get sick and they decide to go with the Medicare Supplement plan. With that, generally, because the risk pool is a little less healthy, you do see plan premiums start to increase a little bit more. So New Jersey actually has extremely competitive rates versus New York and some other states that do have that birthday rule for Medicare supplement plans. But in some states, you are able to make the change, but that's not the case here in New Jersey or in Pennsylvania. So Medicare Part D. So Part D is the subject to a lot of legislation, and we'll talk about some of that, in the next slides here. Medicare Part D, these plans you can change every year. So as your prescriptions change, you can go with a new Medicare Part D plan every year from October 15th to December 7th. The plan structure for these plans is actually gotten simpler over the last few years, where they've implemented an out-of-pocket maximum at $2,000, which is going up to $2,100 in 2026. Currently, if the first stage is going to be your deductible phase. This year, the highest deductible allowable is $590. During this time, member pays for everything and the plan doesn't pay for anything, okay? Except for when it comes to generic drugs, okay? So generic drugs or preferred generic drugs, they're always going to be covered in this, first step. Generally for some are $0 copays, other like a $5 copay for your, commonly used drugs, your like a atorvastatin and things like that, a lot of people use. If you have name brand drugs like a Jardiance or an Eliquis, they're going to be subject to this deductible. You're going to be responsible for that first $590. Once you reach that $590, you enter the initial coverage phase. And at that point, you pay either a copay, most likely co-insurance with most plans, where you'll pay about 25% of the cost of that drug, up until you reach $2,000 out of pocket. Once you've paid $2,000 out of pocket, you've reached catastrophic coverage, where you'll pay nothing for the remainder of the year. I work with some people who have a lot of expensive prescriptions. In some cases, they're meeting that $2,000 out of pocket in January. Okay, so they'll literally go to the pharmacy in January and have to pay $2,000, and then for the rest of the year, they won't pay anything. For some people, that can certainly be, a financial stressor. So they have implemented this smoothing feature, the Medicare prescription payment plan, that you can sign up for. This allows you to spread out your payments over the course of the year. So rather than pay $2,000 in January, I think it works out to about $166 per month. You'll sign up for this plan. You'll be billed $166 per month, and you'll pay nothing at the pharmacy. So a good program there to alleviate some of that financial burden that can happen for those, high prescription costs. Going into some of the legislation that's been changing and being implemented over the next couple of years. So you'll see 2025, they added that $2,000 out-of-pocket maximum. In 2026 and moving forward, they've started negotiating drug prices. So these negotiated drug prices, you'll see what those drugs are on the next slide. They have brought the cost down of them pretty significantly. However, with most of those drugs, if you're on, more than one of them, typically you are going to be reaching that $2,000 cap. As time goes on, more drugs are going to be negotiated. Hopefully the ones that were negotiated this year, the prices continue to go down. And with that, you'll see, again, some changes to Medicare Part D. This past year, with that $2,000 cap being implemented, that was part of the Inflation Reduction Act. It was added in at the tail end of 2024. So the plans were kind of scrambling to, figure this stuff out with implementing their plans for 2025. With that, you saw premiums go up pretty high in 2025, and some subsidies come down from the federal government to lower those costs. This year in 2026, with a year of experience under their belt, the carriers have, started to level out and understand how they can offer these plans, change plan designs to maintain and manage premium costs as well as out-of-pocket costs. I'm pretty confident over the next couple of years, you'll see, these plans start to steady out and premiums start to level out. There's still, like I said, low cost plans available, and, good coverage for pretty much all of your drugs. So it's very rare that we find a prescription that is not covered on any type of plans, but it is, important to revisit these plans annually, as the carriers can change their formularies, which prescriptions are covered. They can even change their mail order program. So which, if they're using Express Scripts, they can switch to a different mail order program. So really important to understand that they can, change their network pharmacies, so they can, change from covering CVS to go to, Walgreens or Rite Aid. I don't even know if Rite Aid's still in business anymore, but they can change those network pharmacies. So really important to take a look at this every year, to make sure you're in, the most cost-effective drug plan. And it's actually very easy. One of the things that unfortunately has happened with Part D plans with this $2,000 cap and it implementing and affecting the profitability of prescription drug plan carriers is most of them have actually cut out brokers like myself for these Part D plans. I do still assist, if you have questions about them or anything, I can still assist with them. But what I generally recommend is using Medicare.gov. They have a great provider finder, and it's actually typically what I use for quoting, where you plug in your prescriptions, your zip code, and the pharmacy you use, and it'll give you your lowest total cost plan over the course of the year. So it'll factor in your prescription costs and your your co-pays, how often you're filling them, and give you your lowest total cost plan. So I mentioned, that low cost plan, $4.40. If you're just taking generic drugs, you'll plug in your prescriptions, and more than likely that's going to be your most cost-effective plan. And it'll give you your estimated total annual cost. So the cost of your premium plus your monthly costs for your copays and what that adds up to over the 12-month period. In the case you have expensive prescriptions, it might recommend a more expensive plan. So you'll see plans that, the premium can be over $100 a month, but you'll see your out-of-pocket costs when you go to the pharmacy might only be, $300. And with that, essentially, you're paying more premium, so you pay less at the pharmacy. But when it ranks the plans, it gives you your lowest total cost plan first. So, you obviously, don't want to go for that $4.40 plan if you have really expensive prescriptions where you're going to be paying a ton of money out of pocket, right? So, it's a great tool. It puts everything in pretty plain English and explains everything to you. And you can actually enroll in the Part D plans directly through Medicare.gov. And again, if you have questions about this stuff, I'm happy to take a look and give you some advice on, what your best options would be. As well, if you're prescribed something through the year that's not on the formulary, okay, so you get prescribed a prescription that's not covered by your plan, you can file an appeal through your doctor to the plan, and they will cover, I believe it's 2 non-formulary drugs per year, if you have something that comes up. So you'll just basically need an appeal form. You can get that directly from the Part D carrier, and your doctor will basically have to submit it and say, hey, he or she needs this prescription. You need to cover it on the plan. Generally, it's granted. And then again, in that situation, that's good for the remainder of the year, but you do want to make sure that the following year, you're looking at a new prescription drug plan that does have coverage for that prescription. So really important to understand these, not just let it go and it will automatically renew year over year, but it doesn't factor in, any changes to your prescription. So really important to understand that, stay on top of it year over year and make sure you're either, confirming that your drugs are covered or switching to a plan that covers it. So I mentioned the drug price negotiation. So these are the first 10 drugs that are being negotiated. If you see any of these that you take, those prices have come down. If you're taking more than one of these, like I mentioned, you are still likely going to meet that out-of-pocket maximum. But important to, make sure you're on a plan that has coverage for all of these. So that way that out-of-pocket maximum comes into effect. So if you are on one of these drugs and it's not covered on the formulary for a plan, it's not going to count towards that out-of-pocket maximum. So the out-of-pocket maximum only applies to covered prescriptions. Okay, so if you let your plan roll over and maybe they've dropped Xarelto off of the plan formulary, you're going to be paying the full cost out of pocket with no cap on that for the whole year. So really important to understand that. Make sure you're on a plan that covers all of your prescriptions, especially if you're on any of these, as there have been changes to these Part D plans year over year. So that's everything I've got on the content, but I'm going to go into the top 5 mistakes people generally make with Medicare and go into a little bit deeper on what some of these mistakes are. So the first mistake is not enrolling in Part B on time. So either missing your initial enrollment period when you're on an individual plan, electing COBRA, and having that gap in coverage for what Medicare A and B covers, or even enrolling too soon. So if you are covered on a large group health plan, I've talked to people who say, "Oh, I'm turning 65. I have to sign up for Medicare." They sign up for Medicare A and B. They're paying their Part B premium, plus they're paying their payroll deduction for their group health plan, and they're not even really using Medicare A and B. So they're overpaying for all that time, that they're on A and B, and they have coverage on that large group health plan. As well, obviously, enrolling too late and accruing penalties, never a good thing. Again, as we just discussed, reviewing Part D plans annually, formularies change, all these things change. So really important to look at this and make sure you're in your best plan for the following year. Next is understanding Medicare Supplement versus Medicare Advantage. So I mentioned underwriting, making sure you understand that, you're not guaranteed to get into a Medicare Supplement plan down the road. So you understand what the coverage options are, what the costs are associated, not just your premium, but your maximum out-of-pocket costs, if you do need services. Understanding the changes during annual enrollment. Medicare Supplement, no changes. Medicare Advantage, there can be those plan changes. And then understanding, some of those extra benefits. I mentioned Medicare Advantage does include generally Medicare prescription drug plan, as well as some limited dental and vision coverage as well. Medicare Supplement, on the other hand, is a little bit more a la carte. So you get your Medicare Supplement plan, you get a separate Medicare Part D plan. If you want dental and vision coverage, you generally have to sign up for a standalone dental and vision plan. We generally work with Delta Dental and VSP, the largest dental and vision carriers in the country, who have, very good networks, and you can sign up for those separate from your Medicare Supplement plan. Next thing, I talked about this a little bit, I'm healthy. I don't need a supplement or an advantage plan. Well, you want to consider that coinsurance, all right, that 20% coinsurance with no maximum out of pocket. And as well, if you just sign up for Medicare A and B, you could be subject to medical underwriting when you do go to sign up for a supplemental plan. So when you sign up for Part B, you have an 8-month guaranteed issue period for the supplemental plans. Outside of that 8 months, you will need to answer underwriting questions to sign up for a supplemental plan. As well, if you don't sign up for an advantage plan, you'll likely have to wait until January 1st to sign up for an advantage plan to start on January 1st. And these can be, a lifetime decision. So if you do have medical expenses and, you miss that open enrollment or special enrollment period, you could be, you could have to go with an advantage plan forever where, again, you're monitoring these things year over year and making sure the plan still works for you. And generally, I find, as people do get a little bit older, that process becomes a little bit harder because the plans are certainly complicated. Where you have different expenses for different things. You're trying to find a plan that covers all of your prescriptions as well as all of your providers. So it can become pretty difficult as far as managing that decision long term. And then finally is listening to family and friends. So, I know, Medicare is certainly a topic of conversation among seniors and just because a plan works for your buddy that you play golf with doesn't necessarily mean it's going to be the best option for you. You want to analyze your total expense, look at your family history. What kind of ailments and sicknesses did your parents have? Understanding what those potential costs are later in life, and understanding everything that goes into it, right? So we, here in New Jersey, we talk to a lot of people who go down to Florida during the winter, and making sure that they have a plan that works for them both up here and down there. And generally in that case, it is a Medicare supplement plan. As well, I know they've cracked down on some advertisements a little bit more, but we used to see, William Shatner and Joe Namath on TV talking about these Medicare Advantage plans. And, they put money back in your Social Security and all this different stuff. They cracked down on them because there were some misleading advertising practices. So, when it comes to, football, I'm not going to, tell Joe Namath what to do. But when it comes to Medicare Advantage, I don't necessarily think Joe Namath is the guy we should be taking our advice from. So important, if not me, talk to another, professional who deals with this stuff all the time. And we can help guide you and understand exactly what those benefits are and what you're signing up for. So, that's all I've got for you guys today. I'm going to turn it back over to Andrew here Again, my contact information is at the bottom of these slides. Andrew's going to send it out after as well. And feel free to reach out to me if you guys have any questions, concerns, or if you just want to go over any of this stuff in more detail. And I appreciate you guys hopping on the call today. And Andrew, you can take it from here.
Yeah, thanks a lot, Bill. And this is super great. I mean, like the biggest takeaways are summarizing big picture. Everything you said is basically enroll in time or be penalized. The income that you're distributing, like during retirement, can impact how much you're charged on your premium. Life-changing events, so like you can submit your form to have your premium reduced if they increase your premium, but they do reconcile that at the end of the year. So you have to be honest and truthful about the life-changing event. Um, if you work for a company that's 20 or less of employees, then you must sign up for Medicare. That's a big one. So if you're working for a smaller company, that's a big one. You can defer your Medicare Part A enrollment so that you can continue to contribute to your HSA, which is huge, because that is money that you can put away for those expenses in the future and actually pay those Medicare costs in the future. And then let's see, Medicare Advantage, while it may be lower cost in terms of the premium, it may hurt you out of pocket wise in a total cost perspective. So short term, it might be less expensive, but long term, it actually could be more expensive. So it seems as though Medicare Advantage is not probably the best choice, specifically too, if you have any pre-existing conditions or if you develop something in the future where you can't change your coverage, which is pretty big. So,
And
like Bill
Andrew,
was
one thing
saying,
I wanted to touch
yeah,
on there, if you don't mind, with when it comes to those HSA contributions, you can use your HSA money to pay for your Part B premiums, but you cannot use it to pay for your supplemental plan.
that's a good,
Okay, so you can, if you have money, accrued in there, certainly welcome to use it for your Part B premiums, especially if you're in a Medicare supplement plan. That's going to be a majority of your expense. You saw with Plan G a $257 deductible. That's really all you would be using it for. But you can use it for your Part B premiums. And generally, I find it's good to save that money and use it, maybe down the line if you do need any, type of maybe long-term care or skilled nursing care or anything like that that might not be covered under under original Medicare or a supplemental plan. So just some food for thought.
that's great. That's good clarification on that. So if anybody has any questions, feel free to reach out to myself or Bill as it relates to Medicare or anything else that you need help with. Our contact information, you could always reach out to myself directly at alight@sfcorps.com or give us a call. And then also, feel free to follow us on YouTube, Facebook, Instagram, LinkedIn. We have a lot of useful content out there for a lot of people. So again, thank you so much for joining today. We really appreciate it. And if there's anything that we could do for you, always feel free to contact us. Have a great day.
Thank you, guys.
Bye.